Hello, good morning and welcome to all my dears. We had completed the common symptoms and differential diagnosis of peptic ulcer disease. So that today we are going to deal with the complication of peptic ulcer. Nowadays, the complication of peptic ulcer is very rare because early detection and early evaluation, timely management, and proper treatment, and well awareness of the publics. That is why usually complications are rare, but at the same time, misdiagnosis or maltreatment or incomplete treatment may result in so many complications. So that let us try to study about the complication of the same. One of the main complication of peptic ulcer is pyloric stenosis. As you know, the lumen of the pylorus is getting permanently stenosed due to the chronic pathology, especially fibrosis, cicatrization, calcifications, etc. leads to fixed narrowing of the lumen of the pylorus. That leads to delayed gastric emptying. In such condition, projectile vomiting can be seen. That means the patient may vomit a large amount of food contents, usually taken 24 or 48 hours of day. So you can see here a very slit-like narrow tube, narrow tunnel. This is the pyloric stenosis. In normal case, you can see a relaxed area of pylorus, but here, due to the fibrosis, the tunnel is getting shrinked or stenosed. It is the pyloric stenosis. And next complication is about the penetration. As you know, the ulcer may get penetrate from mucosa to the muscularis or up to the serosa. It is the penetration, the process of penetration. And after penetrating, it gets totally open. The ulcer makes a hole in the entire cavity of the stomach, and thereby the internal content of the stomach may get spilled out into the stomach, and thereby that leads to severe acute acute peritonitis, or it may be either generalized or localized peritonitis. So next complication of peptic ulcer is perforation. Then let us have a look over the perforated ulcer here. It is the perforated area. It's also, and it is the MRI of peptic ulcer. One more picture is here. You can see these are the perforations. Then due to perforation, there may be leakage of other than the content of the stomach. Along with that, there will be great possibility of leakage of air in the abdomen or air in the peritoneum. So in such condition, while having an X-ray, you can see gas under the, air under the diaphragm. So it is the air under the diaphragm. It's a clean diagnosis of perforated, whether your ulcer is perforated or not. And next about the the grave complication of possibility of cancer stomach. As you know, the Helicobacter pylori is considered as one of the most important carcinogen, biological carcinogen. It excites the ulcer and it maintains the ulcer, and after a while the anaplastic and metaplastic changes leads to carcinomatous changes. So the great complication of peptic ulcer can be a case of CS stomach. So along with all those things, there is persistent pain is there, then persistent bleeding is there, and it is very commonly seen, especially in poor class people. So there is penetration, perforation, pyloric stenosis, probability of bleeding, then persistent pain, probability of cancer, and commonly seen in poor class people. That is why we can make a mnemonic about the complication of peptic ulcer as 7 P's. Here you can see the P's are arranged like this: pyloric stenosis, second penetration, perforation, profuse bleeding, persistent pain, probability of carcinoma, and in poor class people. So these are the common complication of peptic ulcer. But additional to this, there are 3 more complications. These complications are known as hourglass contraction. As you know, the J-shaped shape of our stomach, but due to the various degree of fibrosis, that stomach lost its normal shape, and the lumen of the stomach is getting very narrowed. Automatically the same will leads to very delayed gastric emptying. That is why it is considered as a hourglass contraction. And next, about the lumen of the pyloric stenosis is getting very narrowed, very fixed narrowing, and this complication is considered as the teapot deformity. And there may be, you can see some adhesions of ulcer can be seen in between the lumen, and that is known as the kissing ulcers. So hourglass contraction, teapot deformity, and kissing ulcers are the additional complications of peptic ulcer. So it is this is a symbolic film, a symbolic photo I pasted. It is the hourglass contraction, and very it is hourglass contraction. A narrow tunnel like pyloric canal, that is the teapot deformity, and adhesions of the ulcers can be seen in the gastric lumen, that is kissing ulcers. So these are the common complications of peptic ulcer disorder. And next we have to study about the diagnosis and investigation, management, and proper treatment of peptic ulcer. I think that can be studied in next class. Thank you for watching.